All right, welcome everybody to our BYOG party with Dr. Gator, and he's going to get into that was one question I asked him before I hit record, but I want him to share the story and put it in there with you is where Gator came from, because I'm interested in that. But these are our BYOG parties. I'm so thankful that he's joining us live, and if you're on the recording, you're going to enjoy this too. But BYOG stands for Be Your Own Guarantee, and I want to supply the knowledge and action steps and solutions and strategies and all that good stuff for healthy living practices. And what Dr. Gator is going to be going over with us today is when I saw the title of this course that he had, which is basically natural-minded parenting in this, like trying to navigate this modern medical world. I'm like, this is, right up my alley. So I wanted to see if he would join us today. So he's gracious enough to do this in the middle of his day from seeing patients. But what I want to start off with is just to have him go over a little bit of his background, basically, how he got started in integrative pediatrics, what integrative pediatric is, because I don't know why that's not, well, I do know why, sort of. He'll explain probably maybe why that's not the norm of pediatric healthcare. But Dr. Gator, thanks so much for joining us. Just kick everybody off, let everybody know who you are and why you do what you do and how you came to do that.
Sure. Thanks for having me on. And thank you for everything that you do. Even just talking about this is great. And talking with like-minded individuals about healthy living and thinking about, health in our kids is always fun. So I'm always excited to do these kind of events. And yeah, so going back for me, even before that, you asked about integrative medicine or what integrative pediatrics is. And there isn't really a definition. That's what's crazy about it. To me, what it means is blending the best of modern Western medicine with alternative and holistic practices. And that's the way that I practice. So going backwards for myself a little bit, I did all the regular Western training. I'm a medical doctor, trained at a great allopathic program in Los Angeles. And as I was going through my pediatrics residency and training, I just started getting a little bit more frustrated with the medical system in terms of seeing that the visits were so short. There wasn't enough time to focus on prevention. There were patients and even family members and other people that would go to natural practitioners after being in the medical system for so long, and they would get better. And that didn't make any sense to me. It was like, why does somebody have this chronic disease and they've had problems for 20 years and they go to a naturopathic doctor or Ayurvedic practitioner or whatever, and then they're better? And it's like, well, there's something that we're missing. There's some sort of information that's not making it through. And so that's what sparked me to start learning about integrative medicine and natural medicine. I'm not against Western medicine at all. I always say that I'm not against in any way the amazing things that we have accomplished in modern medicine. And, sometimes we need an antibiotic and it can save your life, or a steroid or an MRI or whatever. That's great. But we're just so quick to do that in modern medicine these days. And so to me, learning about natural medicine and blending that in has been really, really fantastic for me. I really enjoyed it a lot more, and patients seem to love it. And I get a lot more out of it. And so that's kind of my journey here. But after seeing how much people liked it, and especially for me, I guess I got lucky because I'm practicing in California and Los Angeles, and the word got out really quickly after I opened the practice, and lots of celebrities and prominent individuals started showing up to the practice and leaving their pediatricians that they've had for many years to come see me. And it was really weird and eye-opening. So like, why are you coming to me? Like, we just opened this practice. But it just seems that there's a lot of interest in that way of thinking. And so after that, it led me to start, okay, well, I got to get this out there a little more. And there's no training on social media or making courses or any of that stuff in medical school. So that was like the next step of learning a little bit of that to get the information out to the masses. And then just being involved with things like this and just talking and having discussions with families, because it's not common. It's not like integrative pediatrics is not common. It's not common that it's practice, and doctors would have to go back and learn more. And they're already so busy that most of them not going to do it or don't really believe in it that much. And I think it's changing a little bit, but so that's kind of my background. The Gator question, so it's nothing to do with Florida. Everybody thinks it's a Florida thing. My wife's last name's Intelligator, so people started making the joke, I got Dr. Gator, and then it stuck. So it's not a Florida thing. Nothing against Florida. I grew up in Toronto, but it's a wife thing.
Got it. Okay. Am I frozen here, Doc?
No, I can see you.
Okay, cool. And I want to leave it to everybody here or mention this to everybody who's on live with us is if you have any questions, this is for you. I mean, it's a vast, area of healthcare, pediatrics and kids, especially this day and age with all these different diagnoses that are coming out, even with kids and chronic disease and things like that. So I want to leave it a lot to you because I'm assuming you're on here because you either have kids or grandkids or what, and you have questions. We have a pediatrician here where you can ask these questions too. So either, you can put it in the chat, you can unmute yourself or raise your hand. There's down at the bottom of the Zoom here, just to give you a little, to acclimate you. At least on mine, if you hit more, and you can always raise your hand. There's but reactions it says, and then there it says raise your hand. I'll show you just, okay. So that's a good way to do it to keep everything nice and organized. If you have a question, then you can unmute yourself to do that. I'll lower my hand. So I wanted to point that out. Now, the last thing I'll say about that is, Dr. Gator can't give specific medical advice, but he can definitely lead you into the, reframe it in a way that will be helpful to you. Okay. So don't be afraid to ask questions about your kids, grandkids, things that you've heard. So yeah, I guess, does anybody have any questions right now? If you do, either put it in the chat or raise your hand. I'll give you about 5 seconds and then I'll ask my first question if you don't have it. This is for you, everybody. 3, 2, 1. Okay. As we start talking, hopefully you all will have some questions for the doc. I guess my first question is, so as a practicing chiropractor, in our office, we see a lot of, and my wife, she's actually certified in chiropractic pediatrics, so a lot of spinal health care. And that's always a surprise to a lot of people, you treat kids? Why do you treat kids? They got spines, and think about delivery and especially the way that deliveries are nowadays, one with C-sections, and that's not you just bloop, make an incision, they pop out. There's a ton of pressure that is put on the spine, especially right up at the top. So one of the things that we see quite a bit is that kids have, not that we're treating it, but we're helping to restore the function, is ear infections. I would love to get your take on just ear infections in general and, antibiotics for ear infections and what you've seen by giving, chronic antibiotic use with that. And then, okay, that doesn't work anymore. Now we're going to put tubes in. So again, personally, professionally, I would just love to hear about that.
Yeah, it's a great place to start because of any of the common things that we see, it's amazing how overprescribed antibiotics are for ear infections, especially because there are many things when you talk about integrated medicine that you can get into the the woo-woo space or kind of get out there even farther. But when it comes to ear infections, the American Academy of Pediatrics has guidelines for treating ear infections. And in general, you don't need to treat ear infections almost ever, unless it's very severe pain. It's been going on for more than 48 hours. You can give it a couple of days and say, hey, try these things. Even if you're just going modern medicine, try some pain relief and see if it gets better. Because most of them get better, and most of them are caused by viruses. They did studies 50 years ago or whenever it was, I don't remember the exact date, where they were getting samples from behind the ear and looking for what the infections were, and the vast majority of them, 90% or so, are viruses. And then of the bacteria that were there, amoxicillin would treat I think another few percent of it. So it's very, very, very small percent were actually treated by amoxicillin, which is what you get automatically. And a kid goes into urgent care these days and they say they have ear pain and they never leave without a prescription. I don't remember one patient of any of mine that's ever gone to urgent care and then I've talked to them the next day or they message me later in the day and they were not given a prescription for antibiotics. So it's given out like candy because that's the thing that's done. It's easier to treat it and kind of cover your butt and make sure you're treating it than to actually have the discussion about when you need it versus not needing it. And so Yeah, it's way overprescribed. You barely ever need it. I've seen that. When I used to work in the hospital before I was even more integrative minded, it's like this, you just give it all the time. Then you realize, well, if you just have people wait a couple of days, if they have good communication with you, if they're not having severe pain, if you give them some other things to try, like maybe putting some garlic eardrops in the ear, using a pain reliever or some sort of homeopathic or whatever it is that you're into in terms of integrative medicine, then you try those things. It gives you another day or two. Parents feel like they're doing something instead of doing nothing. And then it gives enough time for the body to heal itself. Now, yeah, every once in a while, they have very high fevers. It's getting worse. It's been 3 or 4 days. It's not getting better. The ears are really bulging and red. Sure, then that's maybe an appropriate time to do antibiotic, and that's fine. But that's like 1% of the time. But when you go into urgent care, kids getting antibiotics 1% of the time, they're getting it 99% of the time. So it's there's that imbalance there. And the amount of times that a parent has called me and said like, oh, okay, we went to urgent care, on the weekend or whatever, but they seem like we went there yesterday. They gave us antibiotics. I wasn't really sure about it. They seem a little better this morning. Like, do you think I need to do it? And the vast majority of the time, it's like, well, if they're doing better already and they haven't taken medicine, it's probably viral. So if you feel comfortable waiting another day, that's fine. And 99 out of 100 times they don't end up taking it. And that just shows you, just from my own personal experience, like how many times there should be treated that aren't. And that's what's true across the country, I think. So yeah, it's way overprescribed.
Have you found that parental expectations can guide whether a doctor will prescribe antibiotics or not?
Mm-hmm.
For example,
yeah, so that's yeah, no, it's a good question, and that's one of the things we cover in the course, because that's one of the most common things where I think it's important that people, and it's a great question. I think it's important for parents to understand how much power they actually have in these interactions, because doctors want to do something, and especially if the toolbox is medication and antibiotics, and that's what they're going to give you. And if you go in not necessarily wanting the antibiotics and you discuss that with them, then you're way less likely to be given that as a prescription, or at least be given the option. And the question that I always tell people to ask is, do you feel like I need to take this right now? Right? Do you feel like this is required? And if so, why? Because there are so many times where parents will go to, say, an urgent care or a doctor or wherever, and they will give them the prescription because it's like, well, their ears are a little red or whatever it is, or, oh, we're treating your throat infection. Okay, which one? Do you feel like it's needed? Because if it's a positive strep test, yeah, you might actually need an antibiotic. But you can ask them that question, and then the doctors will say a lot, well, the ears look a little bit red. It seems like they're doing okay. So let me give you the prescription. If you're comfortable with it, you could wait for another day and see if it gets better. And then most of the time that it does. But it involves you being aware and asking that question, because most doctors don't even assume that you wouldn't want to take it. But if you're going in a little bit more equipped, saying like, well, I really don't want to do antibiotics, do you feel like it's necessary? Then you're not being woo-woo. You're not being naturally minded per se. You're just inquiring as to why they're giving this prescription, what they're treating. And if there is a very good reason, they will tell you. They'll say, no, I think this is really important. This is a skin infection. It's going to get worse. You need to do it. Or, well, not really sure. I think it might help, but you can give another day or two and see your doctor and then decide if it doesn't get worse or come back. And that's the majority of the prescriptions that people get. So you can decrease the prescriptions that you get. And kids should not be getting an antibiotic every few weeks. That's not a good thing. If they need it, fine. But there's a lot of bad that comes with antibiotics too.
You just said something right there at the end was, do they keep needing them? They keep getting infections or whatnot. And so then it's like they're getting them actually because they're taking too many antibiotics or too many other drugs, or the lifestyle. Because I know you're big on the lifestyle part of it too, but is it like this just vicious cycle that just keeps going around and around?
I think for a good chunk of kids that are sick, often that is true. There are definitely some kids that, you can get a couple infections in a row, you can be more prone to it, you can have an immune deficiency, but the vast majority of children, they get sick, maybe with a virus like you would for any cold, and you get an antibiotic, which you don't need, or another medication that you don't need. That throws your body out of whack because the antibiotic kills the good bacteria and the bad bacteria. And then you go and you eat some crappy food, and bunch of cupcakes, or you go to a party or eat some pizza or whatever it is that doesn't sit well with your body, and so now your body's dealing with that, and then you spray some air freshener with a lot of chemicals in your home, and you take them into a chlorinated pool, and you drink the tap water and whatever. There's a bunch of stuff going on, and then your body's like, okay, I'm sick, I'm using a medication, I'm having to deal with all these toxins. That's a lot. And so you walk by some other kid, you go to a daycare, whatever it is, they get exposed again, they get sick again. It's a revolving door because they're exposed to viruses and their body has no way to deal with it. And those kids get sick over and over and over again. They get antibiotics every time, and they have an ear infection every 2 weeks because their ears are red. And so it's something that you can do. And I definitely see that in kids where you just get in this cycle.
Yes. I mean, I love how you mentioned some of those, to break it in, or actually not break it down, but you broke it down, but those are, physical stresses we place on our body, chemical stresses we place into our body, emotional stresses that we have, like the chemicals. A lot of parents or a lot of people don't even think about that as affecting our kids, because a lot of times we don't think about it affecting ourselves and how it dampens the resources we have for our immune system. So now, okay, we have to, get the most severe problem first, where the resources have to go to. So I like that you had a few examples of, why do kids get sick, or why do people in general get sick around the holidays? Well, is it because we're colder weather? Well, I'm in Michigan, so it's colder weather, but all around in the wintertime. Or is it because we're loading ourselves, our sleep is off, our nutrition is off, our stress is higher around the holidays?
Mm-hmm.
I happen to think, yes, it's the environment we're putting ourselves into that is dampening that, and we're maybe not moving and working out as much because we're at parties and doing other things.
Yeah, I think it's all of the above. You can be the healthiest person in the world and still get sick, and you can be the least healthiest person in the world and not get sick. But at the end of the day, especially as parents or for ourselves, we're trying to create the best situation to minimize our children from getting sick and to make them as resilient as possible. There's nothing you're going to do that's going to be like, oh, this is a magical thing, you're never going to get sick. No, that's not realistic. But if you don't set them up for success, if you go into the winter where you're inside more, you're surrounded by a lot of other kids and other people that are sick, nobody stays home long enough, when they're sick, so they come out and they're around everybody else. And then you add on to that, not eating well, not sleeping well, more stress, traveling, whatever it is, you're going to get sick. That's how it works. It's not rocket science. It's like if you're you put a kid in a daycare with 10 other kids that are coughing and have runny noses, and they're all touching the same toys, and they're there all day, they're going to get sick. That you can have the best immune system, you're still getting sick. That's how it works. So it's partly about the environment that you put them in, but the kids that have a better environment that their body starts with, they're better, more resilient. They may not get sick for as long. They may not get sick as often. And I for sure see that. I mean, I used to give antibiotics like candy too. That's when I was first training. And that's just all that And now in my office, I barely give antibiotics anymore. It's not that I don't do it if you need it, but I knew all the medicines off by heart in terms of the dosage. And I have to look it up every time now, because it's not that frequent that I need to give a dosing anymore, because it might be like once every couple of weeks that the kid gets an antibiotic. And that it's not like we have kids going to the hospital every day or major issues. It's not that. It's just the families that I have tend to be, I think, a little bit more health conscious, and they don't want antibiotics, and I'm more conscious of doing it. And so, yeah, every once in a while we need to, but it's not like I'm giving an antibiotic every day, whereas before I'd be giving multiple every day. And that very much speaks to the difference of philosophy. And we're not talking about people that are living on a commune or, out in the middle of nowhere. We're in Los Angeles. Like, it's a big city. People are having normal lives, but they're just more health conscious. And so I think that decreases the burden of getting sick for most families.
And that even goes back to people's and parents' expectations when they go see a doctor. Mm-hmm. And going to the emergency room or urgent care, again, in that environment, that's what they know and do. You have created this environment to where, okay, it is more health conscious, or it's more natural based. And I've always had this line where I wish people would be more afraid or less afraid of getting sick and more afraid of getting diseased, because there's a difference. It's like, you're going to get sick. It's okay if you get sick. it's not, but let's do things to help prevent these chronic diseases that are happening. And
Yeah.
I mean, what type of things are you seeing?
Yeah, I mean that's a beautiful point, and I want to emphasize that again because I agree with you. I think we humans have evolved over the last several hundred years from a time where infections were the main cause of death, right? That's the way that it was 100 years ago, a few hundred years ago, where you needed to be worried about plagues and other things, and they killed a lot of people, and we didn't have the sanitation, the food, we didn't have the resilience that humans and just in general have today in terms of these infections. So that's what people were focused on for so long. They were so focused on medications and preventative measures and everything like that around infections. And so that was the predominant issue for so long. Now, for the most part, when people get sick, it's not that severe. Obviously, you can get really sick and things can go in a bad direction if you get unlucky, but that's not the norm. Kids get sick 3 to 5 times every year with a virus on average, and they usually do fine, right? So in general, viruses are not our biggest concern these days. It's chronic disease. Kids, 50% around have a chronic disease, more than that as an adult. Most adults are on several medications. Like the numbers are staggeringly high. It's terrifying how high they are. I mean, you have eczema, rheumatologic condition, allergies, whatever it is. Like it's like depends on which study you look at, but it's somewhere around 50%. It doesn't matter if it's 40% or 45% or 48%. Who cares, right? It's way too much. If you have 2 kids, one of them's gonna have a chronic disease. That's insane. That is insane, and we're not focused on that at all. We're just focused on viruses and diseases, and sometimes that's a good thing too. But we don't give even 1/100th of our time to prevention and to chronic disease as we do to the viruses that are circulating over the last decade, which it doesn't make sense. We should be spending. And on top of all that, if the pandemic taught us anything, it's that your health matters so much. We've always known this, but we know who didn't do well during the pandemic. It was individuals with obesity and comorbidities and diabetes and other health conditions. And that's not new. That's true of everything, but it really, I think, showed itself a lot more in the last couple of years. And we're still not really taking note of that. It's like if we just spent the time focusing on getting more vitamin D and exercising and eating healthy, then you would make such a bigger dent in health over the population than you ever could with a medication. No medication, maybe if like Ebola comes around or something, fine. But like other than that, if you just get everybody to go for a walk every day, you're going to have a lot more effect than any medication that pharmaceuticals have ever come up with. That's for sure.
Yes. We're going to get into a couple of things that are very hot button issues. But one thing I wanted to point out, like the pandemic, how you mentioned that one thing that I was hoping that's what it would have taught us at the very beginning. I remember when it started and the streets were empty, and I'm like, I'm hoping that this is the thing that not just people, the general public, but the higher ups, the docs, the medical community starts rallying around. Okay, let's fix our lifestyle. Let's fix our environment so then we can fight these things off. So then we can, be more resilient. Unfortunately, we know how that went and how that really wasn't the case. But that doesn't mean we're going to give up. But one of the interview I listened to with Dr. James Chestnut, are you familiar with?
Yeah,
the lifestyle, and he gave this good example of if 50% of the whales in the ocean were washing up and getting diseased, we wouldn't look and say, okay, what can we give these whales that are in there to help to, keep them healthier? We wouldn't give them a drug or something like that. We'd look at, marine biologists would look at the environment that they're in and try to fix that. And I always thought that was so like, man, what do you think about that comment?
Yeah. I've given the example actually with a goldfish before. So if you if you have a goldfish and the water's dirty and there's a bunch of chemicals in the water and the fish is not doing too well, you wouldn't give the fish a medicine, right? You'd clean the water, right? Like that's the problem. And I think that's what we have as one of the absolute major issues right now for kids and adults, but especially with kids because they're younger and their bodies are a little bit more immature, and they're not able to detoxify as well as adults can. But even adults just, I don't think, can do it anymore in any event. But it's like we have these amazing systems, right? We can detoxify, we can get out metals, and we can get out most of the things that we shouldn't have in our body through, peeing and pooping and through our kidneys and our liver, all the things that we're supposed to do, and sweating. But there is a point where every single person just can't take it anymore. Your body just can't take it. Your inflammation rises to a level that your body just can't handle whatever it is. And that probably comes from, the things that we're drinking and everything that's around us and all the things that we're doing. And most people before were okay. And I think we're getting to that point where now most people, it's too much for their bodies. And that's what pushes them over the edge into some sort of chronic disease. And that's what we're seeing. And that's why so many kids are sick and so many adults are sick. But at the same time, it's a little bit positive too, because you get the realization that, okay, well, if we've made these changes over the last couple of decades and we've seen such a big move in the wrong direction, if we start making small changes, we can move back into a better direction, because there is a lot that we can control. And we can't control the air that we breathe totally. We can't control the water that's in our faucet, but you can get a filter. You can put plants that clean the air. You can not spray things in your home. There are a lot of things that you can do to control your environment and to improve it as much as you can. And for most people and most kids, that's going to be enough. And that's what I have seen and witnessed, that the families that are health conscious, those kids don't have chronic. Not all of them, but you give yourself a much better chance.
Right. And that's what, like I say in these BYOG parties, this is like, I want to give people the tools to give them the best chance, to increase the likelihood that they can live a healthy, long, pain-free, drug-less, drug-free kind of life. Because it's not always going to happen, but that doesn't mean we don't try, or we don't, again, at least that doesn't mean I don't try and I don't do what I can to do that. So let's get into this. I got a direct message from one of the attendees here, BYOGers, and she had the vaccine question.
Mm-hmm.
And she said, do you have an issue with the vaccine? I'm not sure if she means the COVID vaccine or just vaccines in general, but I would like to dig into that, because I think that's a very prevalent topic, especially with health conscious parents. And I know we had to deal with it. I know you're a pediatrician and you have kids. So yours is a little bit different, but like my wife and I our girls we have 3 daughters. The youngest one just turned 16, got an 18-year-old and almost 20-year-old. So they're all grown up, but navigating the whole vaccine world and, in dealing with that and playing sports and going to school. And, we had to work around that because we just did. So, because it's hard to find doctors, especially in our area, that are more holistic minded. But we were able to do it because it was a priority for us. But that's not always the case. It's who aren't informed on this type of topic. So I would love for you to speak about that in general. Like, how can parents deal with that issue that they have?
Yeah. So vaccines is a tough topic. I think everybody gets it, right? I never talked about it at all before. I'm trying to talk about it a little bit more now. And I think everybody gets why. It's just, for whatever reason, it's such a touchy topic. I don't know if that's because there's a big control from the pharmaceutical companies or whatever it is. As soon as you're talking about it, people lose their minds. I don't know. I don't exactly know why we can't have open discussions about it and talk about the pros and the cons and have a discussion and let people make decisions for themselves. I always start with, as a physician, the CDC schedule is what is recommended. That's what the bodies have, decided, that the powers that be, that it should be. So anything outside of that is personal choice and something that, you would have to decide in discussion with your own practitioner. And I can't tell people to do anything but the regular schedule. I certainly have discussions about vaccines all the time, and my personal opinions don't factor in here per se. I think it's more very frustrating for parents, and this certainly I've seen it at my practice, and it's the most common thing we talk about, is that you're kind of crazy if you do vaccines or you're crazy if you don't, and there's no middle ground and there's no discussion, and everything you read is either like do them all on schedule and this is the way to do it and this is the right thing for everybody, or the other side of things is vaccines are the worst thing in the world and they're murdering people and they're the worst thing ever. And it's like, that's not true. It's somewhere in the middle, like everything else. And the vast majority of parents just want information and want to have discussions and are I think very frustrated with the medical system right now because for whatever reason discussions aren't happening. And it's just like, just do it, it's fine, it's perfect. And the reality of any medication, of any procedure, of anything that you're ever going to do, there's always going to be risks. And I think it's frustrating that we don't have enough of a push to look into something that we're doing to our kids and to really dive deep and go back into the research and do further research on everything. Not that necessarily that we shouldn't do things, but that we should look into everything and not trust a company to give us data on a product that they make money from. It just doesn't make sense. Like, you would never do that for anything else. And if you look at all of the research on medications in general, it comes from the company. And they've already massaged it to look better, right? And then you're going to get a certain perspective from that. And that's not a good way to practice medicine, I think. I think that I'm not against, vaccines. I'm not against medications. We have them all in the office. But I think that we as a society at some point, I don't know when it is going to be, need to get some independent research going, look into everything, and then be open and honest about any sort of potential long-term complications that could come from anything, and then figure out how to minimize those. Because at the end of the day, everybody wants their kids to be healthy, or they want themselves to be healthy. And if there was some magical pill or a shot or whatever that's going to be like, hey, Ebola is coming, you take this thing and you're not going to get Ebola and there's no side effects instead of dying 9% of the time, who's not going to line up to take that? Everybody would. The concept is not the problem. I think the issue for most people is that they don't feel informed. They don't feel like they have all the information. And for the most part, there isn't long-term studies on anything, right? And certainly not in combination. And so the question of what are our actual risks from things, I think is a reasonable question, which we don't have answers to. We only have, you get this medication, here's the theoretical benefit based on the research. You don't really have the long-term risks from that. And I do think if we were to look into that, instead of getting rid of it all, you would just make it better. That's what I think would probably happen, but we just don't have that information. So it's really tough for parents, I think, to make a decision based on missing a whole part of information. It's like, just do it. And that's not good enough anymore, I think, because people have a lot more information. And so that's kind of where we are. And so that's where, at least in the program that I talked about, I don't tell people what to do, but I think the keys there, if you're a parent that's curious about these things, is you got to look at multiple sources, understand that most things that you're going to read are going to be pretty one-sided. So try to read some very medical things, try to read some more woo-woo things, and, things that are out there, practitioners that are more naturally minded, and find some middle ground for yourself. And then you have to ask these questions to your doctor. If you have a certain stance on what you want for your kids, if you want to be more naturally minded, if you want to do things slower, then you have to talk to them about it and find a practitioner that's willing to do it. You don't want to go to a practice where, you have a stance on whatever it is with health and there's something totally different. That's not going to work very well. Those visits aren't going to go very well. So I think it's just about understanding what your priorities are and then finding the right doctor for you. And if you are more naturally minded, then there are more naturally minded practitioners out there.
And I have some other questions, but Eric has his hand raised. So I would love him, if you want to unmute Eric and ask Doc your question, that'd be awesome.
Awesome. Thank you so much, Dr. Gator. Appreciate it. And I've got a 1-year-old son, and I will have multiple questions throughout this webinar. But since we're on the vaccine topic, I thought I'd ask away. We've made the decision not to vaccinate our son, but we are working with a homeopathic professional, both for ourselves and then for our son. Do you have any? They do sell a homeopathic vaccine bundle per se, and I was just wondering, do you have any insight or knowledge into that? And is it worth the expense? Is it worth looking into? Because we're considering it, and to your point, I'm looking at, I'm doing all my research I can, but I thought since you're on here, I thought I'd ask that question first.
Yeah, it's a good question. So we have some patients that do it. I don't do homeopathic vaccines personally in the office, but I know people that go to other places that do it. It really depends on what your goals are. I mean, a homeopathic remedy by nature is a very, 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 very low dose of something. It's meant to help support your body in a certain direction, help your body to do what it's naturally meant to do. Whereas a vaccine is meant to give you an antigen, give you exposure to something like, let's say, polio, like a small part of it, and then your body creates antibodies so that way if you're exposed to it in the future, then it would not let you get sick. So a homeopathic remedy, as far as any research I've ever seen, homeopathic things, they don't do that. So they don't do the same thing. You can certainly do homeopathics if you want to, if you believe in it. It probably does support the body, and it's most likely, based on everything I've ever seen, better than nothing. But it doesn't replace shots. They kind of do a different thing. So you can certainly do it in conjunction with it. You could do it if you want to do that instead of doing nothing. But I wouldn't put them on the same level and say, well, okay, well, I'm not going to do shots with the doctor, but I'm going to do homeopathics and I'm going to be covered and safe. I don't think that's true. I think if you did a homeopathic and you're exposed to measles, it would be like, for the most part, that you haven't done a shot. It might help you a little bit, but I don't think it would prevent it. I've never seen research that would show that. So is that, I hope that makes sense, but it's not a replacement for it, but it's something else that you can do. They're just a different modality.
So basically, in that case, yeah, it's you don't treat it as a vaccine, and homeopathic vaccine bundle probably maybe isn't the right term to give for it. Yeah.
Yeah, I think because you're giving homeopathics of the vaccines, so it's a homeopath, but it's not a homeopathic vaccine, as in like you take this thing and you're protected from the disease. I don't think that's true. I think it's like a little bit purposely misnamed in that way, I guess, so that way you think you're getting more protection than you are. But I don't know, it depends who you ask. I mean, some people very much believe in homeopathy, other people think it's all crazy, right? It's one of those fields that I think it depends a lot on who you work with and the quality of their products and what they do. But there are certainly people that believe in it. I've seen it work very well. So I think that homeopathics in general are a great first line tool, especially very mild for kids, for things like viruses and other things. It's a great first option when they're not very sick. But in terms of shots, I think you can do it if you want to, but I don't think you should think of it as replacing anything. I think it's in conjunction with, but it's not like, oh, you're giving a little bit of this and then you get a little bit of antibodies, so that way it doesn't really work like that, at least as far as I know.
You know, there's a couple things you said when we were talking about the vaccines and people's perceptions or perspectives on them, and you're basically crazy if you do, crazy if you don't. You know, like the whole, and that's kind of like healthcare, right? Like what came to mind was like all or none. You either have to do all of it or none of it, and it's not. There's no middle ground. But like you said, there's always the middle ground with it. And there's one other thing that you mentioned that that parents are frustrated with, because I know I was. Because I hear it from other parents where their doctors just say, just do it. This isn't Nike, but here, just do it. And that always frustrated me. It's like, okay, give me the info. And you mentioned and there's not really any studies on medications in general and long-term effects of them. And my question is, why not? I have my own conspiracy theories. Why not? But
well, I
love your take on it. Give your opinion.
Well, I don't think it's a conspiracy theory. I think it's
again, I don't like that word.
I know what you're saying, but I'm saying I don't think it's conspiracy theory. Though you don't want to throw it out there and say oh, this is. But I agree with you. It's not, to me. This one's not a conspiracy theory. This one's pretty easy. It's you follow money, right? And
yeah.
It's very expensive to make a medication, and they put a lot of work and a lot of things go nowhere. So companies want to make a lot of money from their products, and whatever they can get on the market, they want to do that. And so they don't have a lot of incentive to do anything that shows that their product is not good. And so they'll do whatever the minimum is that they're required to do to prove that something is safe and get it on the market, so that way they can't find long-term problems. So when you're doing a study, let's say of a new drug, and you study it for a couple of years, let's say, if you're lucky, you get 2, 3, 4 years follow-up with some of these patients. Most of them are not that long, but let's just say, for argument's sake, that we're doing that. But that's still not very long. We're still not talking 10, 20, 50 years, especially when it's something you're giving to kids. And so if a medication helps you with something 1 in 100,000 times, but it also causes 1 in 100,000 eczema, 1 in 100,000 autism, 1 in 100,000 ADHD, 1 in 100,000 whatever. That's what we don't know. And there's no way to know that unless somebody studies it. And why would a company who has a product on the market that's met the minimum standards do that? Why would they find a problem with their product? Like, there's no reason to do that. And they still, even if you look at the inserts of anything, it's like, oh, or watch a commercial, like they might cause this, might cause, so like they do see a bunch of bad stuff too. And that's just within the half a year or a year, maybe 2 years that they've studied it. And they're like, well, it's kind of at the rate of the population, so we're not super worried about it. And it just happened to one person, so it was probably fluke. And this one person died, but people die. And it's like, well, all that stuff is true, right? Things happen. People get heart attacks, let's say. So if one person gets a heart attack and dies in a trial, is that because of the medicine, or is it because they just died of a heart attack? And so they always have that kind of defense, right? And it's true. Some people die of whatever at any point in time. But if you don't study enough people, you don't study it for long enough, and you don't do it independently, then you're not going to find these things, and they're not going to do that. Why would they? I mean, that's just common sense. Like, if we don't make them do it, why would they find a problem with their own product? Their job is to make money, so they're not like nefarious in that way. It's just they're going to try to get the best products they can that do the most benefit for people, but they want to make the most money, so they're not going to find a problem with their product. We have to. And think about and they know, like, how long does it take you, even if something gets on the market, to figure out, this is killing people? It's like, it takes years. They made their billions already. They don't care. They've already made their billions. They know. They're not, I don't think they're like actively trying to kill people or put products on the market that cause problems, but I think that it's a plus minus for them, and they want to make lots of money. And if they can put something out that's relatively safe, they're not going to find the small problems.
Yeah.
So I don't think it's conspiracy. That's just that's like common sense. That's what you would do if you're running a company.
I hate that word. I hate the word conspiracy, because many times they turn out to not be.
Yeah, they're not
actually be the truth. Yeah. So I'm glad that you went the other way and just told it like it was. If anybody has any other questions, put them in the chat. Raise your hand. I want to ask this because I mentioned it already. In the area that I live, it's hard to find the holistic based, natural minded pediatricians. Is there somewhere, like, we'll talk about Raising Amazing, but is there like a association or anything like that, like for integrated pediatrics? Because I'm assuming not, but I need to ask where they could find somebody in their area, or there's like a directory, or
there's not really a directory. The best one that I've seen is Dr. Green Mom. She has a list of some naturally minded practitioners. So that's a place you can go. Dr. Green Mom, I think it's drgreenmom.com. I don't know. I think it's that. But if you Google it, you'll find it. But there's a couple of ways that people can go about finding natural practitioners. So number one, there are some integrative practitioners that exist. So you can just type in integrative pediatrician or whatever and find a doctor like that if it happened to be in your area. That's number one. Number two, you can find a naturopathic doctor that sees kids. So you can always see two different people. You can have a pediatrician, you can have a naturopathic doctor. You can go to your pediatrician if you have a medical concern. You can go to your naturopathic doctor if you're not super concerned. And then they can see you first or see you in conjunction with your doctor. So most places have naturopathic doctors or health coaches or things like that. Or chiropractors. I mean, there are a lot of chiropractors that have functional medicine training now and can do a lot. I mean, chiropractic is an interesting field because it's such a weird, like, wild west of different practitioners out there that do like all sorts of things that I've like come to realize. And there's some people that like have extreme knowledge in a lot of fields and know a lot more than doctors do in some of these things. Not as many in pediatrics, some, but mostly adults. But there's certainly a lot better training in the medical side of things now. So I mean, even a functionally medicine trained or integrative medicine trained chiropractor could be your number two. You can work in tandem. You can work in a team. Like, there's nothing wrong with that. So you can do that too. Or finally, you can ask around. So the best place that I've seen, like in Facebook groups, there's naturally minded Facebook groups. You just search your area and be like, hey, I'm living in Michigan, this city. Anybody know another doctor who's holistic minded? And then usually people will tell you. You're not going to be the only holistic minded person in your city. So there are going to be some people that are at least open to it. You might not find somebody who's going to make homeopathics for you, which is fine. But even if they're just open to having discussions, and that's probably going to be good enough for most people, and they don't, make you feel bad when you're there if you have a question about something, and they might not know the answer to some things, which is fine. I just think it's it's not fine if you make people feel bad, but as long as you are open to it, then I think that's fine. And if you want more, then you find a practitioner online, or you find somebody who's a naturally minded, not doctor, but can do a lot of this stuff. And then you just work together. Because at the end of the day, the doctors are really there for, this thing is very serious. We don't want to miss this. This is cancer. You need to get the screening, but you can still work with any other practitioner for all the other stuff. And as long as you've ruled out the bad stuff, then it's fine if you work with somebody else, I think. I don't see why you couldn't.
Yeah, beautiful. I appreciate that. And, you mentioned, you talked a lot about making sure parents are informed, getting the information, so they can make the right decisions. And so that's where I'd like to end this, is basically, again, we have limited time, obviously, at this party, and there's a lot more information out there and questions that people have. And he's both, either live here or even people watching the replay. Well, actually, before we get to that, Eric raised his hand. He's got another good question. Eric, go for it.
All right. I figure I'll just ask away since we're limited time. Our 1-year-old son just really kind of started really bad tantrums within the last, couple of weeks. Is that normal, just being a baby? Is there something possibly we should be looking at that maybe we're doing or not doing? So just wanted to get your thoughts on that.
In general, tantrums around that age are very normal. I mean, they call it, the terrible twos or whatever it is for a reason. And for the most part, kids, the second year of life is the terrible twos. It doesn't necessarily start when they're 2 years old. So a lot of kids will start getting more frustrated because they don't have the language. They start understanding things a little bit more and they want what they want, but they don't really have the language skills yet to really express it. And so it comes out as frustration. So could it mean other things? Sure, anything could. But if they're growing well and they're generally healthy and they're eating fine and there's no other major developmental concerns, then I wouldn't be super worried about it. It's probably just regular, toddler development. But if there are other things that you're worried about, like their speech delay, they're having other issues, the tantrums seem, way outside of what you would ever consider to be normal, then that's something you could always get looked into or see a developmental practitioner. But starting having tantrums and having some, I don't know, every kid has tantrums around that age, so it's probably normal.
All right. Wish I would have known that when my girls were.
They get over it though. They're not still tantruming in college yet.
That's right. That makes perfect sense though. Like, again, just simple little things like that need to be reminded of, is they're starting to understand, but they're not able to communicate that with the parents or other people. So that makes perfect sense of how that works. Any other questions from anybody? Eric, if you got another question, it might be your time again.
Well, okay, I'll fire away then. We're mostly plant-based in our home. And so my wife just kind of weaned off. We did breastfeeding, mixed in some Ollie goat's milk in a bottle as he was getting older. Then we've really been buying our own organic cashews and making cashew milk with the goat's milk. I've been reading stuff that is a little bit concerning about some nuts, and obviously with cashews. Do you have any input on if we're doing something bad to our? I mean, he looks perfect. He's growing great. He's a healthy boy. I'm a little concerned that maybe we're doing too much cashew milk with him. Do you have any insight into that? Should we maybe be mixing up our nuts and doing different sources and not just doing just cashew milk?
Yeah, good question. So first of all, I mean, with the bigger question of like vegan, vegetarian, in general, kids could be super healthy and do just fine. There are certain kids or certain adults that whatever kind of diet they're going to be on isn't going to work well for them. So as long as they're growing and healthy, then, it sounds like we're doing well overall. So I think that's a good thing. The other question of cashew milk all the time, I mean, that's fine as long as they're eating and getting all their nutrition from other places in terms of all the other things that you need. My concern, and not because of cashews, but just with everything, is you just never know what's in anything these days. And if you're doing something every day or all the time, then if you're buying, let's say, the same kind of cashews from the same bag, from the same place, then in a year from now, they're like, oh, this cashew had too much lead in it, or this cashew we found from this farm had this. So to me, I'm always a fan of diversity and trying to mix things up, because you're going to get different nutrients. And if there are any toxins or chemicals that are there that we know or we figure out later, then at least you're diversifying things and your body isn't getting a buildup of any one thing. So to me, I always tell people, they ask about milk and whatever. I say just rotate, do different ones. If you're going to do nuts and you're going to make it yourself, that's great. Just use different nuts. There's like pumpkin seeds, and there's cashews, and there's almonds, and you can use all sorts of different things to make milk. So just try different ones, and that should cover your bases in terms of just minimizing potential. So it doesn't mean that there is. I don't know. I'm just saying that realistically every day or every month, it seems like we're like, oh, there's this crappy thing in baby formula. Oh, there's this crappy thing in rice. We can't have rice cereal anymore. It's like whatever it is, it just seems like food is not made like it used to be. So anything you're doing all the time and drinking a bunch of glasses a day, that's where you run the risk of having some sort of chemical in there that could cause a problem long term, because you don't really think about it. You have one glass, it's fine. But if you're drinking it every day for 3 years and you find out there was some lead in there, well, that could be a problem. So that's what I tell parents in my office.
That's beautiful advice. I think that's spot on. Diversifying, getting in. From what I hear you saying as well, is even if it's cashews, if you're doing that, get cashews from a different source.
Right, exactly. So yeah, so even if you're if you're buying apples or whatever, like don't buy from the same store, from the same farmer's market, from the same person every single time, because then you run the risk that there's a problem. And I don't care how good something says it is or somebody says it is. You don't know. Like you could have the best farm and maybe the farm beside them is not good and there's stuff getting into their water. I don't know. Like I think just diversifying is the way to go, because all of our food's crap these days anyway. So the more you diversify, the better that it is.
Yes, I like that.
Food is so bad. I don't know. Like every week you're like, oh, they're spraying this on our food. You realize, oh, they sprayed that on our produce. It's like, oh, it's organic, but then you realize they spray something 5 minutes later after they pick it. It's like it's pretty bad. Our food is bad.
Well,
I don't know.
Thanks, Eric. I appreciate those questions. Those are great. I mean, because it leads, again, these questions, whether you have them or not, it leads into more discussions and it just jogs things in people's ideas and solutions that they can come up with, and strategies and ideas. But I don't want to leave today without actually showing you, and I'll put it in the chat, the website and my link to go to it. But it's, raising, I keep wanting to say Raising Arizona. Everybody know, if you're in the Gen X,
Florida, going to Arizona,
Raising Arizona, that movie back in the 80s, Nicolas Cage, but Raising Amazing. Please tell us about that, because I look at this and I'll just give a little background of why I love it. Like I used to have programs for parents and courses. It was up. If you see my email, it's still doc@upgradedparents.com, because I wanted to help parents. And like, this was like what you have here for the kids is exactly what I wanted to have for parents to take care of themselves. So go ahead, tell them what it is, why you created it. And I think from what our discussion today, it makes sense of why you created it.
Yeah, so the two main places to find me, most people will find me either on Instagram, Dr. Joel Gator, or Raising Amazing Plus, which is a website that I created. I had some other courses before, but I kind of migrated into this to make, go a little bit more focused and more integrative spin. So there's a few courses on there. One is the Naturally Minded Parents Navigating the Western Medical Systems, just trying to answer the questions that I get from parents on interviews all the time, like the stuff that we talked about today. So it's a lot of that, but just diving into a little bit deeper, especially with the vaccines and other things like that. Also, there's a pregnancy and newborn course, so just kind of me and my wife discussing what we went through and things to expect. There's a holistic pediatrics course. So that one is like the things that you might see for kids that you can think about in a holistic way. So like ear infections and rashes and coughs and colds, all the stuff that you're going to see in general. And then stressless parenting course. So that one, just a bunch of practitioners and talking about how to de-stress. And that was post-pandemic and kind of getting to a better place. There's lots of different programs and things like that you can go. And they also have a free vaccine handout and simple shifts handout if you sign up to get the free. So you can go in and you can get a sneak peek. So if you just sign up, then you can get a sneak peek and then you get those downloads. And then if you want to purchase anything, you can.
Yeah, I just wanted to take them there and share my screen so everybody can see what we're talking about. And it's just set up amazing. Again, so many, like, just going through the different courses. Naturally Minded Parents, Stressless Parenting, Holistic Modalities. I was looking through that to see, chiropractic or spinal health care. And I think there's if there's not anything in there, let me know, and maybe I can supply some type of class or course with that, or my wife and I can, since she's actually certified in chiropractic pediatrics. But man, this has been great. I hope everybody enjoyed this, got a lot out of it. I will have the replay link up ready tomorrow. I'll have the link to Raising Amazing Plus, along with what Dr. Gator's offering is a 20% discount on these. So I'll give you the discount code for that in that link, tomorrow's email, and also on the page that it's going to be. Not sure if there's anything else you want to share with us, Dr. Gator, or last tips of advice or wisdom for our parents, but I appreciate you being here.
Yeah, I can. Well, I'll finish with my number one tip always is that read food labels. We should be reading everything that you buy. If it's a long chemically name, it's probably not good for you, and most of the food is crap anyway. So just buy real food, buy real things that have actual names that you actually know, and then you're at least, a much further way down, and they're going to be eating much healthier than if you're buying prepackaged sugary snacks and treats and foods that have a lot of preservatives in them that are not going to be good for you. And finally, we talk a lot about doom and gloom. I do sometimes talk about the doom and gloom of the chronic disease, but at the same time, there's a lot that you can do. And if you make a 1% change here, 1% change here, 1% change here, it makes a big difference. You don't have to go through your pantry and throw everything away. There are little things that you can do, little improvements that you can make. And if you do that, then you're going to get most of the way there. And I think that, to me, there is just so much that we can do, little things, and it makes a huge difference. And you can't change everything, but you can change the environment for your kids, and that makes a huge difference.
Exactly. And I'm putting this back in there because I think it just got sent to one person. And that goes to one of my, what you just ended there goes to one of my core values, which is simple and consistent effort. It's not big sweeping changes, because that tends to be unsustainable. If you're trying to, again, it's the all or none mentality. How many times have you gone on a crash diet only to maybe probably gain the weight back tenfold? When you stop, it's because it's not sustainable, because you try to do everything all at once. So this has been great, Dr. Gator. I appreciate you being here. Everybody watching the recording, definitely check Dr. Gator out and all that he has to offer. Man, this is great. Thank you so much for being here, everybody.
Thank you. Thanks, everyone.
All right. Stop.